If you or someone you love takes any of the medicines I'm about to mention, please stay with me for the next few minutes, because what I'm about to share with you is something that most doctors simply don't have time to explain during a 10-minute appointment. I'm a licensed pharmacist, and over the years, I've seen one problem come up again and again. People taking completely common, everyday medicines, not knowing that those same medicines can slowly, silently damage their kidneys. Today, I'm going to walk you through 5 of the most common ones, and I'll also tell you exactly what you can do to protect yourself. Let's get into it.
Why kidneys matter. Before we talk about the medicines, let me quickly explain why your kidneys are especially vulnerable as you get older. Here's something most people don't know. After the age of 40, your kidney function naturally declines by about 1% every single year. That means by the time you're 70 years old, your kidneys may only be working at about 70% of what they once could. Now, this is completely normal. It doesn't mean you have kidney disease, but it does mean that your kidneys are less able to handle certain medicines the way they used to. Medicines that were safe for you at age 40 can be much harder on your kidneys at age 65 or 70. And the tricky part, kidney damage often has no symptoms in the early stages. No pain, no warning signs. That's why it's called the silent organ. So let's talk about the 5 medicines you need to know about. Medicine 1, NSAIDs, ibuprofen, Advil, Motrin, Aleve, common painkillers. The first one on our list is probably sitting in your medicine cabinet right now. NSAIDs. That stands for non-steroidal anti-inflammatory drugs. The most common ones are ibuprofen, sold as Advil or Motrin, and naproxen, sold as Aleve. These are incredibly popular for pain relief. Arthritis pain, back pain, headaches, millions of seniors take them every single day. But here's the problem. Your kidneys need a steady supply of blood flow to function properly. NSAIDs work by blocking certain chemicals in your body, and one of those chemicals is responsible for keeping blood flow to your kidneys. When you block it, blood flow to the kidneys drops, and when that happens regularly over weeks and months, the kidney tissue starts to break down. Now, taking ibuprofen once for a headache is not going to hurt you. The danger is regular use. Daily or near daily use of NSAIDs is where the damage happens. And the risk is even higher if you're also taking blood pressure medicine, diuretics, also known as water pills, or if you already have any degree of kidney disease. What you can do, talk to your doctor or pharmacist about safer alternatives for pain. For many types of pain, acetaminophen, sold as Tylenol, is much gentler on the kidneys. If you do need to take an NSAID, use the lowest dose for the shortest time possible and drink plenty of water. Medicine 2, Metformin, common diabetes medicine but dangerous if kidneys are already weak. The second medicine is Metformin, one of the most prescribed diabetes drugs in the United States. Now, I want to be very clear here. Metformin is generally a safe and effective medicine for most people with type 2 diabetes. I'm not telling you to stop taking it. But here's what you absolutely need to know. Metformin is processed by your kidneys. If your kidneys are already weakened, which as we discussed is more common as we age, metformin can build up in your body to dangerous levels. This can lead to a rare but very serious condition called lactic acidosis, where acid builds up in the blood. It can cause weakness, nausea, difficulty breathing, and in severe cases, it can be life-threatening. The key number you need to know is your eGFR. That stands for Estimated Glomerular Filtration Rate. It's a simple blood test that tells you how well your kidneys are filtering. If your eGFR drops below 30, most guidelines say metformin should be stopped. Between 30 and 45, the dose needs to be carefully adjusted. What you can do, ask your doctor, what is my eGFR? If you're on metformin, this number should be checked at least once a year, ideally every 6 months. Write it down. Know your number. It could protect you. Medicine 3. Certain antibiotics. Gentamicin, vancomycin, and some others. The third category is one that most people never think about: certain antibiotics. Now, most antibiotics are completely safe for your kidneys, but there are a few that doctors call nephrotoxic, meaning they have the potential to damage kidney tissue directly. The most well-known ones are gentamicin and vancomycin. These are powerful antibiotics, typically given in hospitals through an IV, usually for serious infections. But there are also some oral antibiotics and antifungal medicines that can affect the kidneys with prolonged use. The reason seniors are at higher risk is because lower kidney function means these drugs stay in your body longer than they should. The dose that's safe for a 35-year-old may be too much for a 70-year-old. And the dangerous part, kidney damage from antibiotics can happen within just a few days of starting treatment if the kidneys are already compromised. What you should do, whenever you're prescribed any antibiotic, especially in a hospital setting, ask your doctor, is this medicine safe for my kidneys? Has my kidney function been checked before starting? A good doctor will already be monitoring this, but it never hurts to ask. You are your best advocate. Medicine 4, contrast dye, used in CT scans and imaging, the one nobody warns you about. Now, this fourth one I want you to pay close attention because most people have never heard of this risk. If you've ever had a CT scan with contrast or a certain type of heart procedure, you may have received something called contrast dye or contrast media. It's a special liquid that's injected into your vein to make certain tissues and blood vessels show up more clearly on the scan. The problem is that this contrast dye is filtered by your kidneys. And in some people, especially older adults with already reduced kidney function, it can cause what's called contrast-induced nephropathy, a sudden, sharp drop in kidney function. In most healthy people, the kidneys recover, but in seniors with borderline kidney function, this can sometimes trigger a permanent decline. And here's the part that worries me as a pharmacist. Most patients are never told about this risk before the procedure. What you can do, before any scan or procedure that uses contrast dye, ask your doctor, is contrast necessary, and given my kidney function, is it safe? In many cases, doctors can take extra precautions, like giving IV fluids before and after to protect your kidneys, but only if they know you're at risk. Medicine 5. Proton pump inhibitors, omeprazole, Prilose, Nexium, pantoprazole. And our fifth medicine, this one surprises almost everyone I tell. Proton pump inhibitors, or PPIs. These are heartburn and acid reflux medicines. The most common ones are omeprazole, sold as Prilose, and esomeprazole, sold as Nexium. These are some of the most widely taken medicines in America. Many people take them every day for years. And for a long time, they were considered completely safe for long-term use. But in recent years, multiple large studies have found a concerning link between long-term PPI use and an increased risk of chronic kidney disease. The exact reason isn't fully understood yet, but researchers believe PPIs may cause a type of low-grade inflammation in the kidneys over time called interstitial nephritis, and the risk increases the longer you take them. People who've been on PPIs for more than 2 years show significantly higher rates of kidney decline in these studies. What you should do, ask yourself and your doctor, do you still need this medicine? Many people started a PPI years ago for a short-term problem and are still taking it out of habit. There are other ways to manage acid reflux: dietary changes, H2 blockers like famotidine, elevating the head of your bed at night. Talk to your doctor about tapering off if you've been on a PPI for more than a year. Okay, so we've covered a lot today. Let me quickly recap the 5 medicines to be aware of. Number 1, NSAIDs like ibuprofen and Aleve. Avoid daily use. Switch to Tylenol for regular pain. Number 2, Metformin. Know your eGFR number. Get it checked regularly. Number 3, certain antibiotics like gentamicin and vancomycin. Always ask if kidney monitoring is in place. Number 4, contrast dye used in CT scans. Ask about the risk before any imaging procedure. Number 5, PPIs like Prilose and Nexium. Question whether long-term use is still necessary.
Now, 3 simple things you can do starting today to protect your kidneys. First, stay well hydrated. Drink 6 to 8 glasses of water a day. Your kidneys need water to flush out everything, including medicines. Second, get your eGFR number checked at your next doctor visit. It's a simple blood test. Ask for it by name. Write it down. Track it every year. Third, every time you see a doctor or start a new medicine, bring a complete list of everything you take. Prescription medicines, over-the-counter medicines, vitamins, supplements, all of it. Your pharmacist can check for kidney-related risks in minutes. That's what we're here for. I want to close with something important. I'm not sharing this to scare you. I'm sharing it because you deserve to know. Because this is the kind of conversation that should happen in every doctor's office, but often doesn't, simply because there isn't enough time. You are your best advocate, and the more you know, the better you can protect yourself. If you found this video helpful, please share it with someone you care about, a parent, a spouse, a friend who takes any of these medicines. And if you have questions, drop them in the comments below. I read every single one. I'll see you in the next video. Take care of yourself.